Prinzmetal's angina, variant angina, is chest pain from coronary artery spasms. We'll explore its causes, symptoms, diagnosis, and treatment. Knowing this helps doctors diagnose and manage the condition for better patient care. Let's begin by gaining a clear understanding of the basics of Prinzmetal's angina. Unlike typical angina, which is primarily caused by atherosclerotic plaque formation narrowing the coronary arteries, Prinzmetal's angina is primarily due to abnormal coronary artery vasospasm. The exact cause of the vasospasm in Prinzmetal's angina is still not fully understood, but it is believed to be related to abnormalities in endothelial function, smooth muscle tone, and sympathetic nervous system activity. These abnormalities can lead to the constriction of coronary arteries, resulting in reduced blood flow and subsequent myocardial ischemia. Now, let's explore the underlying mechanisms of coronary artery vasospasm in Prinzmetal's angina in more detail. Endothelial dysfunction, characterized by impaired production of vasodilators like nitric oxide and increased release of vasoconstrictors, plays a pivotal role in the pathogenesis of this condition. Additionally, abnormalities in coronary smooth muscle tone, including increased contractile responsiveness to vasoconstrictive stimuli and decreased relaxation, further contribute to the development of vasospasm. Sympathetic nervous system hyperactivity, particularly in response to physical or emotional stress, can trigger coronary artery constriction, exacerbating the symptoms of Prinzmetal's angina. In the diagnosis of Prinzmetal's angina, recognizing the characteristic features of angina episodes at rest is crucial. The chest pain experienced is severe and prolonged, lasting more than 15 minutes. Episodes commonly occur during the early morning hours. Other symptoms may include dyspnea, diaphoresis, palpitations, and syncope in severe cases. To accurately diagnose Prinzmetal's angina, doctors look for a combination of symptoms, specific changes on an electrocardiogram, ECG, and rule out other causes of chest pain. The ECG should show temporary ST segment elevation during angina episodes. Other tests may also be used to confirm the diagnosis. In Prinzmetal's angina, transient ST segment elevation on the ECG during angina episodes is a characteristic finding. This elevation corresponds to the affected coronary artery and can help diagnose and manage the condition. Coronary angiography plays a crucial role in confirming the diagnosis of Prinzmetal's angina. However, detecting coronary artery spasms during angiography can be challenging due to their transient nature. In some cases, provocative testing with ergonovine or acetylcholine may be necessary during the angiography procedure to induce coronary artery vasospasm and visualize the spasms in real time. This additional step can help validate the diagnosis and determine the appropriate treatment approach. Provocative testing using ergonovine or acetylcholine is a valuable tool in diagnosing Prinzmetal's angina. These agents are administered during a controlled setting to induce coronary artery vasospasm, mimicking the symptoms experienced by the patient. The presence of chest pain, characteristic ECG changes, and angiographic evidence of coronary artery spasm confirm the diagnosis of Prinzmetal's angina. However, it is important to administer these tests in a monitored environment under the supervision of experienced healthcare professionals due to potential complications such as severe coronary artery spasm, arrhythmias, or myocardial infarction. Once the diagnosis of Prinzmetal's angina is confirmed, prompt treatment is essential to alleviate symptoms and prevent complications. Calcium channel blockers, such as nifedipine and verapamil, are the mainstay of treatment due to their ability to relax coronary artery smooth muscles and prevent vasospasms. These medications not only improve myocardial blood flow but also help reduce the frequency and severity of angina episodes. Long-acting nitroglycerin preparations can also be utilized to provide immediate relief during acute episodes by promoting vasodilation and enhancing coronary blood flow. In the acute management of Prinzmetal's angina, nitroglycerin is used for rapid symptom relief by dilating blood vessels and improving blood flow to the heart. Rest and avoiding triggers are also recommended, along with educating patients on proper nitroglycerin use. In summary, lifestyle modifications play a significant role in managing Prinzmetal's angina. Quitting smoking, reducing stress, adopting a heart-healthy diet, engaging in regular exercise, and controlling other risk factors can improve cardiovascular health and reduce vasospasm episodes. Despite the potential for recurrent episodes, Prinzmetal's angina generally carries a favorable prognosis. With appropriate medical therapy and lifestyle modifications, the majority of patients experience a significant reduction in the frequency and severity of angina episodes. However, it is crucial to emphasize the need for ongoing medical therapy and regular follow-up to manage the condition effectively. Even with optimal treatment, a small subset of patients may still experience periodic vasospasms, necessitating continuous monitoring and adjustment of the treatment plan. Distinguishing Prinzmetal's angina from other causes of chest pain requires careful consideration of clinical features and diagnostic criteria. The differential diagnosis of chest pain includes various cardiac and non-cardiac conditions that may present with symptoms similar to Prinzmetal's angina. Conditions such as myocardial infarction, aortic dissection, pulmonary embolism, and gastroesophageal reflux disease should be ruled out through appropriate diagnostic testing. It is crucial to thoroughly evaluate the patient's medical history, perform a comprehensive physical examination, and utilize the appropriate diagnostic tools to ensure an accurate diagnosis and appropriate management. In conclusion, Prinzmetal's angina is chest pain due to coronary artery spasms. It is important to understand its causes, recognize its symptoms, and use appropriate diagnostic and management approaches for optimal patient care. Adhering to guidelines and staying updated on research will improve patient outcomes.